The procedure on this specific patient, we observed a noticeable seagull wing effect occurring. Retraction occurs at these 2 points. At this point and this point. Therefore, we will want this particular value to be a bit lower for better results. We want the distance to incline upward and the sides to rotate. At the point we call the baby lip, the patient has a tubercle protrusion. We will attempt to reduce it a little more on the sides, but we will make sure to avoid blocking the teeth. In other words, when the filling is done, the patient's teeth should be visible in any case with the correct filling technique. If you fill under the muscle, the patient's lip will droop down significantly like this, extending that precise distance. Even if lips appear attractive, the teeth become unseen when smiling. Therefore, the biggest criterion for superficial filling is that half of the patient's teeth should be visible when the lips close. Now, when I stand like this again, I want to turn to the side. Look, I want you to clearly see that noticeable tubercle protrusion from the side once more. Yes, I turned. Now, another important point to carefully pay attention to in such patients is the overall contour line of the patient. The contour line is clearly defined. If you perform a procedure on a patient with a distinct contour line, you will pull the lip forward even more and the expression will be further distorted. Therefore, you must perform the entire procedure within the red line for these patients. Now that we have comfortably laid down, we will begin our procedure.
Yes, basically what we need is for the indentation here to be corrected to form a straight line again.
We noted that the patient has a very distinct contour line. We do not conduct procedures on the contour line. Enter through the red dot. Again, we entered from this middle point. We progressed. We avoid turning the needle at the tubercle's midpoint. From this specific point, we initially created a superficial stick that extended upwards into the air. We immediately progressed sideways. We reached the wet-dry junction. We created a rather superficial stick once again. And we moved a bit further to the side. We remain in the wet-dry mix, and we continued our journey towards the only single entry point of our stick that pointed upwards. Now, I sense a slight stickiness in this particular area. I've become even more superficial in this context and attempted to alleviate that stickiness by leaving a very small drop of substance right at this specific point. And I see the same stickiness at this point as well. Here, my needle became somewhat superficial as well, so I decided to open up that stickiness by adding a little filler inside. Up to this point, I haven't managed to deliver even 0.05 of the product. I'm continuing to make my moves by delivering very little product. Now I've come a bit more laterally. Here I have successfully completed my injection. Now I'm currently at the part where the main indentation on the patient's lower lip is located. Where am I entering from here? I'm entering from below the red area, meaning well below the contour line. I've come back to this point again, delivering and stepping back. I move forward once more, pulling back gently while still giving. I'm filling this space.
I'm not moving up there.
Look, I'm completing my injection here. Since my primary objective is to hold the retraction that occurs at the gum line, I need to address the retraction at this stage. I carefully made the filling, then gently placed it at the gum line, diffusing it with my fingers and precise manipulations. Now I'm continuing my injection laterally, slightly tilting the needle to point more directly towards the tongue for better accuracy and effectiveness. So far, the total amount of product I've used is 0.1 units. Let's close our mouths for a moment and check things out. Allow me to take my sitting position once again. Please keep your mouth open. Look at the side where there is retraction between the two sides. Look at the difference on the other side. Now we will also apply a filling effect to the opposite side. Currently, I am still at 0.1 of the product used so far. Again, I entered just below the contour line from the red area. I haven't approached the area of the middle tubercle. Look, there is a clearly visible adhesion here. I have officially entered into this adhesion. I'm carefully pulling back and gradually filling a bit into this adhesion to ensure a smooth application.
Some people have compartments like this inside their lips, friends. In his latest anatomical study, Sebastian Kotofana demonstrated these compartments. He said that on the right and left of the lip, some people have 3 different structures that seem to have ligaments in between, and there is no passage between them. And yes, when you move on this lip, for example, especially at this point, it feels like there is a structure here, and it resembles a band going from top to bottom. You feel like the 2 parts of your lip are separating from each other. Therefore, you are opening that sticky area by moving your needle back and forth to create a tearing effect. If you ask me, I feel like they are adhesions formed as if related to the dryness of the lips. But of course, I can't know the specifics of the job. I'm continuing to fill the wet and dry mucosa on this side as well.
My primary goal is to achieve a perfectly equal appearance with a well-balanced midline that aligns beautifully at the gum line. When I come in laterally, my needle is positioned parallel to the patient's mouth, carefully aiming towards the tongue area. It is gradually moving in that specific direction. Let's take a look at the view from the front again.
Let's take a close-up shot.
Yes, there is still some noticeable deficiency on the left side, and there remains an issue on the right side of the lip as well. We will continue with the lower lip injections and check the upper lip again. This patient doesn't need much filler in the lower lip. We're simply trying to ensure that the middle section is narrow and elegantly curves downward for a more appealing look. We tried to create a small roundness in the center of the lower lip, which we call the pillow effect. We created a flatter appearance here to make the lip turn downwards more. With this way, we have balanced the ratio of the upper and lower lip.